Cervical Cancer Awareness Month is observed every year in the month of January. This is the fourth most common cancer found in women across the world. Interestingly, this can be treated and prevented. In today's episode, let's explore more on these things. Hi, hello and welcome to Healthcast by Happiest Health. We have Dr. Shobha with us. Hello doctor, welcome to the show.
Thank you.
Doctor, my first question, right? When it comes to cervical cancer and those things, women shy a lot.
Yes.
Right?
Yes.
They just don't open up.
Yes.
Right? And we know that these things have to be discussed.
True.
How do you have to, any suggestion for women on how to deal with this?
Cervical cancer, as you said, it's the fourth most common cancer globally, but in India it is number 2.
Okay.
Okay, it was number 1 all these years, but now breast cancer has taken over. It is number 1, followed by it is cervical cancer. Every 8 minutes a female dies due to cervical cancer. Why is that? Because most of 75 to 80% of them come in advanced stage. So the problem with this is our female, as you said, they hesitate a lot, they have this shyness, and they don't give the priority. It's not there for them. So first their family and other people, and then last is themselves.
Right.
And main thing here, because we are talking about cervix, which is an internal organ, and our culture is such way that people shy to talk about anything internally, right? So they will go for a delivery, so that during delivery they do not, that's a natural process, and they don't hesitate. It is taken for granted that they have to undergo that. But when it comes to cervical cancer, people shy a lot because they can tolerate it. They can tolerate it until advanced stage, and once it becomes intolerable, then they come to the clinician. So we'll have to talk more and more, and we have to bring about this awareness, not only in elder females, but also in youngsters, because this is a health style related cancer.
Okay.
So definitely, even nowadays we are going to school kids also, giving them awareness regarding this cancer.
That's nice.
So college kids, not even girls, even boys also should be aware. So awareness, health education is the most important thing. I think that will break the barrier.
Right. Awareness is the key. And what are the risk factors, doctor?
The main risk factor is related to the etiology. So here the necessity causes human papillomavirus infection, right? So how do we get this virus? It's a sexually transmitted virus. So do all sexually active female get cervical cancer? No, not really. So it's only about 10% of them who have persistent HPV infection. They go on to progress for cervical cancer. Otherwise, 80 to 90% of them, this virus spontaneously regresses without any treatment.
Okay.
So only that high risk, now you asked what are the high risks, right? So a female who have this high risk factors, in them the infection goes on to become cancer. So what are these high risk factors? One is the age when she has started her sexual activity. So the early this start, the risk is very high for them. And then the age at which she delivers the first kid first. If she delivers between that 18 or 19 years, definitely the risk for HPV infection persistence is very high. And the number of times she delivers. So we used to have nowadays it's become less, but we used to have people delivering more than 5 times in olden days. So there were cervical cancer is to be number 1. So multiple deliveries leading to cervical erosion, tear, the local immunity of the cervix is lost. So they are at high risk. And then of course immunocompromised lady, a female who has HIV infection, they are immunocompromised. So they are at slightly higher risk than a normal female. And then apart from this, a female who will have multiple sexual partners, or who is having a partner who is having multiple sexual partners.
Okay.
So both ways the female is at risk. Apart from this, other nutritional deficiency, like her innate immunity is low, like if she's having deficiency of folic acid, vitamin E, vitamin C, all these, they basically when her immunity is less, the HPV infection won't get regressed. So she is at slight higher risk. But main thing is because of her age of sexual activity, age at when she delivers first, and multiple sexual activity.
So in this case, doctor, unsafe sex with multiple partners.
Yes.
So that is also one of the thing for HIV, right? So if you could help us understand the difference between HPV and HIV in this case.
So HIV is that's also caused by a virus,
Right.
which is sexually transmitted. But there, once she contracts that virus, the symptoms will appear within 2 to 4 weeks.
Okay.
Symptoms.
Okay.
So symptoms could be like flu-like symptoms initially. So it need not be a genital symptoms like vaginal symptoms. They'll have multiple symptoms related to multiple organs. Whereas when when a female gets HPV, that's human papillomavirus infection, the symptoms are not seen. So the symptoms due to this infection is not appreciated by the female initially. Okay, until it becomes cancer. So that is the problem. So many people won't even know she has HPV she has contracted the virus. So it comes, it just goes away. So what symptoms she has? Only she gets symptoms only when it develops a lesion there on the cervix. Then the symptoms appear. So what are those symptoms? And this period of appearance of symptoms can vary from each person. So the latent period, like HPV infection contraction to the cervical cancer appearance could be from 5 years to 25 years.
Okay.
That latent period is quite long in them. So we cannot pinpoint and say that okay, after like how we say in HIV infection, within 2 to 4 weeks she'll have a flu-like symptoms. We won't have in HPV. So that is the difference.
Right. Is this cervical cancer related to age, or if so, at what age should one be very careful?
Yeah, so we say they can present with bimodal age, like early age also. Female can have early age means between 25 to 40 she can show up, or postmenopausal between that 55 to 65. Okay. Bimodal presentation we say.
Okay.
So but nowadays we have seen that all age group it can be detected. There's no specific, like how we say for CA breast, age related, it is more the age, the risk is very high in them, above 60. But in cervical cancer there is no specific age affinity. So a female who starts her sexual activity early and she has all these risk factors, she can be diagnosed with cervical cancer at the age of 30 itself. So we do see between 30 to 35 quite a lot nowadays. So there's no specific age. So when the HPV infection is affected, and then how she progresses is what matters.
Okay.
By chance in between, like we have some tests. If she has undergone some tests, we can make out she is infected or what.
Right. There are multiple cases where the cervical cancer, once it's gone, it's come back. There's a reoccurrence.
Yes.
Why does that happen? And if it comes, what should one take care? What are the precautions as you suggest?
See, any cancer, for the success of its treatment depends on the stage mainly.
Okay.
So early stage cure rate is very high. Cervical cancer 90 to 95% we can cure if detected in stage 1.
Okay.
So stage 2 it comes down 80% we say. Stage 3 it comes down to 60%. Stage 4 the cure rate is not there. It's only palliative treatment. So depending on that the recurrence also happens. So early stage cure is high. So recurrence is very rare.
Yes. Okay.
Yeah. And then stage 2 maybe yes recurrence will be there, but slightly later, maybe after 4 years or 5 years. So stage 3 recurrence can happen because it's locally advanced and certain factors are there which will dictate the recurrences, like prognostic factors what we call. If they have poor prognostic factors, recurrence is bound to happen within the 2 years. So if it happens, then next modality of treatment we advise. So if she has undergone radiation, then we'll ask for chemotherapy, or if surgery is feasible, we'll ask for surgery that way.
Okay, so this is just not with respect to cervical cancer, any cancer?
Any cancer, yes.
Okay. Now we know that a lot of things we see in the world could be the newest form of illnesses, right? It's all because of the lifestyle change that is. Any lifestyle change as a doctor that you would recommend to avoid cervical cancer?
Yeah, definitely. That is the only thing what we can advise.
Please.
Because most of the cancers we don't have answers when they ask why me, why I am diagnosed.
Right,
so that's the question all our patients ask, and we don't have an answer. except for the cervical cancer actually.
Right, okay.
So because we know the reason. So
This
it
is
is
very
HPV.
interesting.
And how do we get HPV? It is sexually transmitted. And when you have started your activity is what matters. So most of the girls are not aware of this. So that is the sad part. See, until I came to a medical thing, even I was not aware of it. But nowadays the awareness has become better. So I think most of them through your media or magazines, or when we go for camps or something, we do give the awareness. So what we advise is, yes, apart from healthy eating, healthy sexual practice, so be aware of what you're doing. And of course stress is one of the important factor. Now all studies have shown that it can be one of the factor for pathology in, etiology in cancer.
Okay.
So like how it causes diabetes or hypertension, it can cause your cancer also.
Okay, stress.
So stress, definitely, yes. So de-stressing ourselves and balanced life, I can say. So don't take too much of everything. So eat healthy and keep a check on your weight. So obesity is one of the risk factor for many cancers. So physical activity has shown to reduce so many cancers by 50%, scientifically proven. So it could be CA breast, or it could be endometrial cancer or colorectal cancer. All that is reduced just by 40 minutes of walk. So and 10 minutes of meditation this is I think with our balanced diet. So more of a protein diet with a little amount of good fat. So I think a lot of greens and fruit intake is very less in our females. So even the vegetables, most of the time they put everything to their husbands or kids. Whatever little is there, they consume that. They don't make it a point to consume in particular.
As a nature,
Yes, yes. Okay. So I think that intake of fruits and vegetables every day should be a must. And then whatever we advise, alarming symptoms like, early symptoms, you asked about
that was my next question.
Yeah.
So now, if there are, what are the symptoms that, this is something that I need to visit?
Yeah. So the one thing is by nature, a menstrual cycle every month a girl gets. So any deviation in that, so it could be intermenstrual bleeding or spotting. So or bleeding after the act of sex, post-coital bleeding, what we term it as. If there is, or any discharge, a foul smelling discharge which does not subside even after taking local treatment or treated with antibiotics, all that, in spite of all that, she keeps having foul smelling white discharge. So these three are the most common symptoms for a female with a cervical lesion. Apart from this, if it becomes locally advanced, then she can have problem in urine, like she can have blood mixed in urine. While passing urine, she can pass some blood, or fecal matter or urine passage through the vagina. Whenever the tumor infiltrates the bladder or rectum, so they can have fecal matter and urine passing through the vagina. So that is very rare nowadays we find it, but they can have the symptom. Otherwise, persistent backache, whenever the plexus or pelvic side wall is involved, we say persistent backache. So this all little kind of interpose with their other routine.
Correct. That's
daily,
what maybe today I traveled too much on two-wheeler.
So
that's
they
why
relate to something else. So, but we can make out when it is a kind of natural, some physiological change, or it is pathological. I think we can ourselves make out. Like we eat something, we are getting pain, we can relate to that. But persistently something is coming over the days or a month. So definitely that is not normal.
Okay.
So then I think that time at least they should come and approach the clinician. So, but common symptoms is intermenstrual bleeding, pain after the coitus, and foul smelling white discharge. Or sometimes we do a screening test called pap smear. So whenever there's any abnormality in that, we pick them up. So a couple of them are diagnosed through these tests also. Yeah.
Right. Doctor, after menopause, some women will tend to have bleeding, right? So the question is, does bleeding after menopause means cancer?
Not always. So most common causes due to hormone deficiency,
Okay.
So estrogen is totally reduced after menopause, and estrogen is a kind of hormone which would give us a lot of what do you call, like good hair, good skin, and a good sexual activity, that kind of nature, all that thing, it used to help us. But once we get our menopause, estrogen is totally deficient, and then they have a lot of symptoms, like it could be hot flashes, they'll have bone pain, etc., all these things. So, and postmenopausal bleed also is one of them. We say it's senile endometritis or senile vaginitis. So related to this menopause. So 70% of them is due to this. So cancer is only in 10 to 15% of them. So in postmenopausal bleeding. So need not be cancer always.
But must visit a doctor.
Yes, definitely yes. Because postmenopausal bleeding is an abnormal symptom and it should be evaluated.
Leads to another question of mine. Early symptoms of cervical cancer can be confusing for menopausal symptoms.
Yes.
How do we know the difference of it?
Yeah, so as I said, this postmenopausal bleeding can happen one in cervical cancer or in endometrial cancer commonly. Okay. Cervical cancer means there is a lesion, abnormal growth on the cervix. So usually until the growth becomes big, bleeding won't happen. Or if she's a sexually active lady, after the sexual act, there will be bleeding from the lesion itself. That is very. But a female, if she's not sexually active, most of our females are not sexually active after 60. So until the growth becomes too big, they do not have the bleeding symptom. So endometrium is one where commonly postmenopausal bleeding occurs. So even that, so we do a basic scan, and in that they'll give us what are the thickness of endometrium and all. Depending on that, then we, of course, examination. So as I said, they have to be evaluated. So clinical examination, as soon as we see a cervix is normal or abnormal, we can make out. So we'll tell that. If a scan is done, endometrial thickness is given. If it is abnormal, then we do something called as DNC, endometrial biopsy. So with that, we make the diagnosis. So, but as you said, it should be evaluated by a clinician.
Right. There are some of us whom we come across, I'm healthy, I'm fine, I have a very good lifestyle, I eat good, I don't have a family history of anything. Why should I get tested?
True, very true. This is very common in all our women. So most of the time we give a cancer awareness lecture, and then we'll call them for the pap test, then they'll run away telling all this.
Right.
Yeah. So cervical cancer is one. It's screening has been very impactful. So screening is what? Screening is a procedure where we are doing a test on normal, healthy women. And picking up something abnormal which is not seen on our eyes, from our eyes. So as I said, if we look at the cervix, if it is looking normal, then we do this test called as pap test. So pap test will pick up something abnormal under the microscope. So we are seeing the cells from the cervix. If there is something abnormal, then accordingly we will tell them what the treatment is. So before it turns into a cancer, we are detecting pre-invasive stage. So this is there only in few cancers. So that's why I said screening is the most impactful thing in cervical cancer. Not all cancers can be prevented.
Right.
So I think though women insist that we are healthy, we don't have family history, we have to be persistent that yes, this is done for healthy people only. So you don't have to have a symptom to get the test done. Yes.
Right. At what intervals do you recommend this test to anybody? Usually
from the age of 25 itself, we recommend pap test up to 65 years, at least once in 2 years or 3 years. So when guidelines say once in a year, but I think most female do not come. But nowadays tests also have said that once it is 3 reports are normal, then they can repeat once in 3 years.
Once in 3 years. If things are normal.
Normal, yes. The first 3 pap tests are normal, then once in 3 years. And we have something called HPV DNA test also now. So if pap and HPV DNA test is done, then if both are negative, then once in 5 years.
Doctor, we know that this is preventable by the vaccination. At what age should people take this vaccination? One. And second, though I know that there is some age limit for it, people who have crossed that age, do you recommend them as well to take?
So we do have a vaccine because it is the HPV what is causing this. So we have vaccine against this HPV. So HPV vaccine is what is called. Usually it should be given before a girl starts a sexual activity. So why do we have to give this? Don't we have our antibodies is one question. So any virus, usually our body produces antibodies. But it does produce, but the antibodies are not very strong, and it doesn't sustain for long.
Okay.
For us to have the memory. So, like other infections, we'll have antibodies which will be there for lifelong. But here we don't have. So, we'll have to give this HPV vaccine, which produces a stronger antibody, and studies have shown it is persistently in high levels. So, even after 20 years, the antibody levels are quite high.
Okay.
So, this should be given to girls between the age of, ideally between the age of 9 to 15.
Okay, 9 to 15.
9 to 15. Up to 25, we still can give. But I think after 25, she will be exposed to HPV, many varieties of HPV. So, we won't recommend, but if they want, the company says up to 45 catch-up period is there, they can take. But mandatorily, they have to still undergo PAP test.
Okay.
Even though they are vaccinated, they are not 100% covered. So the vaccine will work 100% only in younger age group before the sexual activity. Yes.
But however, up till 45 can take.
They
if
can.
They wish to.
Yes, they can take. But PAP test is mandatory.
Got it. What are the preventive measures for this? Because we know that it is preventable. One, of course, is with the vaccination. Is there any other preventive measures that you would recommend?
As I said, screening test like HPV DNA test or PAP test or liquid-based cytology, we say. So these are the tests which all females should undergo after 25 years, once in 3 years or 5 years, depending on the report. And then avoid the risk factors, like as I said. So create awareness amongst the school girls, because they should be aware how it is coming. So I think once nowadays kids are very smart, so they will take care of their health. That's what we hope for. So preventable measures mainly through education and vaccination, awareness, yes, and PAP test, screening test, because other countries like Finland and all, it is zero. Okay. Incidence is zero because of this organized screening programs. So US also, the mortality came down by 75% because of this PAP test. So that's how impactful it is. But only thing is, here in India we don't have an organized screening program, not recommended by government or any organization. So people still don't come forward to regularly undergo, like how they get their sugar tested or ECG done. They won't do it for PAP test. So that is the reason still the cervical cancer is common among Indian women.
Doctor, one last question I would want to ask, based on your experience. I'm sure you've been specialized in oncology. You must have seen a lot of cases, right? Based on your experience and your observation, what is that one message that you want to give to women regarding the cervical cancer?
Cervical cancer?
Yes.
So be aware of how it is caused. So HPV infection. Then secondly, undergo this screening test, PAP test, at the right time.
Irrespective of the family history or anything. Yes,
no symptom, no this one, still undergo a screening test, PAP test. If you are beyond 45, then vaccinate your kids or anyone younger. And then alarming symptoms, as we said, don't hesitate, don't be shy to come and talk to your clinician. Please come forward. Anything abnormal, evaluate, get an examination done. So don't go just over the counter and ask for a tablet or a pessaries to keep internally. That happens very commonly. So avoid that. So any persistent symptom, evaluate, get examined, and then take the treatment. And always, when you deal early, treatment is very simple. That should be kept in mind.
Right.
And don't blame the doctors for not getting cured.
I get that. So like the doctor said, it's learn, prevent and screen. Actually, this is the theme for this year's cervical cancer as well. The doctor kept on saying prevention is better than cure. So with this, we wrap up today's episode. Doctor, very nice talking to you. That's a lot of information that you gave. Very quick, very easy to follow and very practical for all the women to follow.
Thank you, Pallavi.
Thank you.